We're going to end at 5, and they get a half hour each. And so I don't want to cut into their time. I've asked them both to introduce themselves as they want. And so I'm going to turn it over to Dave Weiner right now. And thanks a lot, Dave.
Yeah, thanks so much, Charles. I will do a quick screen share, and then can everyone see the screen?
Yeah.
Cool, great, thank you. Yeah, I'll do a quick introduction, as you said, and then we'll dive in. Thanks so much just for having me here, Charles Sohaila. Great to be here. As mentioned, my name's Dave Weiner. A little bit about my background is former PhD student at the University of Pennsylvania. Got very into entrepreneurship and sort of haven't looked back ever since. Co-founded a company and did pretty well, but made some big mistakes along the way too. And I sort of in retrospect wish I would have been able to do a program like NSF I-Corps. It would have helped me, I think, tremendously as an entrepreneur. So I hope it can be a resource for some of you to avoid making some of those same mistakes. Since then, I guess at least right before coming to Berkeley, where I'm at right now, I was an early hire at Springboard, which is right now actually a Series B educational technology startup based in San Francisco. And it was really there where I learned a lot about this. We were constantly, it was an online, a remote learning startup. We're constantly launching new courses, doing something called customer discovery to really validate, the market before we launched the product. And that was an eye opener for me. So now, once I saw that, I've been loving it ever since. And now I'm at Berkeley, where I'm the program director for the Bay Area NSF I-Corps program, where we help early stage startups coming out of Berkeley, UCSF, and Stanford with the customer discovery process. And it's something I'm very, very passionate about, sort of the perfect mesh of a few things I love. I get to work with academic founders who have developed new technologies in their research to make a much bigger impact on the world. And also just get to work with early stage startups. I love that early stage. So as you might guess, NSF I-Corps is a program for the earliest of early stages of translating even just a startup idea or a new technology to a startup. It's using a process that we call customer discovery to really will validate at those early stages, who is your customer and why? And this program is really designed by the NSF with technical founders in mind, professors, postdocs, PhD students. Like I said, it's really a translational research program at its heart. Take it out of the lab into industry. So not only is no entrepreneurial or business background required, it's not needed, no MBA needed. You don't have to have any prior experience running a business to do this program and to create a startup. But having said that, this is a process that's really used by anyone. For just our July course alone, we run a course every month. I'll talk more about that in a minute. We've got definitely some faculty, postdocs, PhD students, of course, but also a number of MBAs. We have a couple undergrads in it, and just some serial entrepreneurs, those who are just like early stage founders in the Bay Area. We have one who founded a company 6 years ago, did Y Combinator, sold their company to Penumbra. Now they have a new project and they're back to do it again, go through the process all over again. At its heart, this is something I didn't really know when I first got into entrepreneurship, but entrepreneurship at its heart is really all about solving problems. And because of that, really anyone can do it. Anyone who wants to help people solve a big problem or fulfill an urgent need. And NSF I-Corps is designed to help you to identify the biggest problems and the biggest needs that customers or stakeholders might have. So we have this process called customer discovery. And back when I actually started, I did this. I did a business plan. It was very long. It was dense. I talked about who my customer was and why, and this enormous market that I had. But it was really just, as I reflect back, a little bit naive and sort of full of hypotheses. but I actually really didn't know that any of it was true. Now we know there's a better process. Get out of the lab, or for you all, for many of you at least, the lab. Go out there and talk with people, and that's what the customer discovery process is. Sounds easy enough, but some surprises in there. I think it's not about sales. You know, when I first heard customer discovery, I said, well, obviously that's what starting a business is. You go out and you discover who your customers are and you sell to them. No sales involved in this process whatsoever. You don't lead with your tech or your technology. In fact, if you're doing this right, you'll never mention or discuss your technology. It's not product testing. It's not user feedback. It's really getting out and listening and learning. And I would define it, I actually think customer discovery itself is a little bit of a misnomer. I would really define this process as getting a much deeper understanding into all the different stakeholders who influence whether or not your technology will ultimately be adopted. Some of those stakeholders will be indeed the customer or the decision maker or decision makers. There's also sort of a whole ecosystem out there that you really need to validate first. It could be people who are just influencers, the end user. The end user of your product could be very different than the decision maker. And probably for most, if not all in this room, regulators. That could be a big part of how your technology will be adopted. What is the timeline for it? Who are the stakeholders involved? What data do they need to make these decisions? So that's a little bit about the customer discovery process. Take a step back and say, you probably have all heard something like this at least once or twice, probably many times. Most startups don't make it. Why? I would argue most don't make it from a lack of customers, not really a lack of product. If you look at sort of like the top reasons why startups fail, this is just sort of one survey, so not the final word on it. Product market fit is when you identify a need in the market, you build a solution that customers then want to buy. I would argue most, perhaps not all, but most reasons why startups don't make it do come back to lack of product market fit, just not enough customers, not a big enough market. No market need, okay, that one's obvious. But if you really go down the list, I think most of them fit this. Ran out of cash, like to run out of cash. Not enough customers, maybe not enough willingness or not enough want to pay. Maybe not the right team. Okay, we'll skip that one. Get out competed. That's at least on the edge of that. Again, not enough customers. Pricing cost issues, not enough customers, not enough willingness to pay enough for you to have a scalable business model. Product out business model. Okay, that one's an obvious slam dunk. So you get the picture. Recently had a conversation. This is sort of a friend of a friend. I didn't know them before they started this journey, but they quit their job about a year ago to found a startup. And I kind of had the conversation at the postmortem. They were lamenting that it just totally failed. It didn't work. Harvard MBA, had worked in product and tech for many years, super sharp, and they couldn't figure out what went wrong. And they really said they thought they did everything right. They'd gotten out there, they talked to a ton of people. Feedback they got was really positive. Everyone said they loved it, but this sort of stuck with me. They said, everyone said they loved it, but I ended up spending a year building a product that nobody wanted to pay for. Why does this happen? This seems like a total contradiction. How do we avoid this? Can't forget, customers really don't care about your technology. They ultimately care a lot about their problems and their needs. And at these really early stages, doing sort of tech first interviews or conversations, product first, user interviews, user feedback can sometimes really obscure this for many different reasons. For one, no one may want to tell you that your baby is ugly. So it's really hard when someone presents something to necessarily give them the totally unvarnished feedback. But it's possible this founder still got it. That could just be one element going on. There's a team that I'm working with now who's going through this process. They're actually out of the Berkeley School of Ed. Very unusual, but really cool to work with an ed tech team. Probably the first I've seen them in a few years in this program. And the founder or co-founder's doctoral dissertation was on validating the need for teachers to adopt and to use a digital intervention in the classroom to help students with ADHD. And they did all these surveys and qualitative data, and they found resoundingly, the answer was yes, I would want to use a digital intervention, basically an app or a platform that could help with this. Definitely a problem there. They did identify a problem, and the teachers all said, yeah, I want this. But 2 years of research, and I think they've definitely got some really optimistic start, but they were ready to build the product, go to market, and they did start to build the app. But I don't know if that still got to everything they really needed. Is there a willingness to pay? I don't know that they know that yet. Is the teacher the payer? Are they the decision maker? Probably not. I don't know who is. It may be the teacher, could be the teacher, could be a parent. More than likely, my guess is it's a principal or someone at a school district. And they may have very different values and very different objectives, problems, needs, and budgets, constraints to deal with. Who knows what it is? We need to find that out to really understand, is there enough of a market? Is there a willingness to pay for this? And they also, sort of through those surveys, didn't quite get their finger on the pulse of the user flow. So the teachers absolutely said, I will use this. They're the end user. That's really important. But at the same time, what is it really like to teach? What are those flows like when you're in that classroom? 35 students, maybe one or two might have ADHD. Are you going to use this app in the middle of class? Do you use it after? How long does it take to impute what you need to? Will teachers their day-to-day? What are their flows like? And what are their sort of biggest problems and issues that face them as they teach? And so really understanding the user flow case is also super important. And sometimes that's not something that just sort of generic survey questions or presenting this and saying, would you like this, can get to. So how do we get to it? Well, I would argue, slight bias, but customer discovery interviews take a very different tack, which is it's not about your technology, it's not about your potential solution. It's all about listening and learning and understanding their biggest problems, their flows, their priorities, their needs. So we try and get to that through a lot of open-ended questions. Asking to tell me about ... I think for the team I just mentioned, asking, tell me about the last time you adopted a new technology for use in the classroom. Can you walk me through that? That will give you the full spectrum of all the stakeholders involved, the data they use, how they even initially learned about that new technology, how they go from that very first point to ending up in the classroom, and how much they pay for it. Maybe you'll find that out. Be curious. Understand what are your biggest challenges through the day. Maybe this is a problem they've identified, but maybe there's even bigger problems, more urgent problems out there for the teacher, for the principal, for the school district to tackle. So limited budgets, what's going to get the money? So really understanding, the biggest challenges without leading them is important. Asking why a lot. I find that is super helpful. Just if someone tells you why they're doing something, ask them why. It actually can make us all think about it. But open-ended questions to just really try and get a much deeper understanding into who cares, why do they care, how much do they care. And I won't give you too many more examples. I might have gone a little bit off on that last one, but this one might be more suited for this room anyway. So I'll give you a quick minute. This is a team that I mentored a couple of years ago. out of Michigan. Founder was ophthalmologist, had developed a corneal wound healing agent, helped to heal the cornea 50% faster from abrasions, and could lead to, was hypothesized at the time, instead of the LASIK procedure, there was a better procedure that could be done, which was a little more invasive, but was, I think, overall a better procedure. And so this would facilitate using that. You can help the patient heal 50% faster. And you think, well, what doctor wouldn't want that? What patient wouldn't want to heal 50% faster? Seems like a no-brainer. Turns out it was really a nice to have, but it was not a must have. And as we started to ask, eye surgeons questions on, again, walk me through the last time you did a LASIK procedure, last 2 times. It really turns out, and I've had LASIK done, you go in, you have it done. It's a bother for a day or two. And if you're a surgeon, you probably hear from the patient. I can't even remember. Maybe it's like a day or two after, just check in. And then you'll probably see the patient in a week or two, make sure everything looks good. It's usually 10 or 15 quick meeting. And that's probably it for the vast majority of cases. And so the follow-up and the healing time, yes, you would say I would want that, but it just wasn't a really urgent problem facing them. Also, for this specific user case, there's always a cost to switching to. So you always have to be providing some extra value. In this case, so there's always some cost of switching. In this case, there was actually surprisingly a larger cost of switching, because a lot of the doctors would say, hey, we have invested already in all the infrastructure to do the LASIK procedures. I just bought all this a year ago. I don't want to junk it and then have to buy all this new equipment. It just doesn't make sense because this isn't a big enough problem for me. So I don't really need, there's no urgency for me to change it. It definitely, it's actually going to cost me a lot of money. So they had another pathway forward, not to worry, but it's better they found that out much earlier in the process, and then go the other way, which is they are in the process of licensing to a larger pharmaceutical company who can really bring their discovery to market. So you really have to find a hair on fire, sort of irresistible problem. And then when you can solve that, that's a magical thing. The program I run is called Bay Area iCore. We run a program every month. It's a 1-week-long program. There's no cost to it whatsoever. I know actually there's some folks, I saw some familiar names who have taken this course this summer. Fantastic teams coming out of this program. I've done it 3 remote sessions from 5 to 8 p.m. So about 9 hours of class time. It's about 20 to 30 hours outside of class too. It's a very busy week. It's all there for a reason. I'd say every minute you expend doing this will save you 20 minutes and that you would otherwise expend over the next 6 months. It's really a de-risking program more than anything, to keep you from going in one direction, get the information early, then you don't have to backtrack and go the other way. You have to have a team of at least 2 people, but you can get more. You can probably get 5 or 6, even if you wanted to help sort of plateau off the workload. Obviously, tech-based startup or startup idea or early stage startup that fits all of you in here to a T. You conduct 15 customer discovery interviews in that week. You'll really validate who your customer is and why, and accelerate finding product market fit. Something I love about this and why I think it's a valuable experience for really everyone to have, it's really a mindset shifting program away from the technology onto an understanding of the other, the client, the customer, the stakeholder, whatever you might call them. And that in whatever pathway you go in life, definitely as a startup founder, having a company, business, entrepreneurship. But if you work for any biotech company, if you work for any tech corporation or any pharmaceutical company, whatever it may be, you always are going to be working with different stakeholders. You're always going to be probably trying to find ways to help people. And I think doing this, really shifts you into that mindset, and teaches you how to get that understanding and how to solve those problems. Also, something else cool about this is that it really doing this program pipelines into other opportunities, other resources, other structured supports, for especially university spinouts. There's the National NSF I-Corps program. So the 1-week program, Bay Area I-Corps, you'd then be eligible for the National NSF I-Corps program. That's pulling teams from all over the country, as you might guess. It's run by the NSF. 7 weeks long, 100 customer discovery interviews. Also comes with a $50,000 grant from the National Science Foundation for customer discovery. So you can use that to go to conferences and really build out your network. Conference fees, flights, hotels, and even meals. You can really leverage that funding to really foster a lot of connections. And these initially are customer discovery conversations, interviews, whatever you may call it. But almost always your first customer, your second customer ends up being found in these conversations, because you will go back to them in 6 months' time. And then you can say, hey, remember that conversation? Well, now I've got something. I've got this thing that can help you that you mentioned was a big problem. I just spoke with a founder who said that exact same thing happened to him. And it was, now he's a year past. So really, really exciting stuff can happen from that. And this is basically the National Science Foundation's pipeline for translating inventions out of the lab discovered through research into industry. This will also help you tremendously to just improve your fundraising odds. I have on the slide the NSF SBIR, that's the grant program from the NSF. Phase 1, they give about over $250,000, totally non-dilutive, meaning they're not going to take any percentage of your company or your IP. They just want to help you to have a much bigger impact on the world. NIH also has an SBIR. You can apply to both. And national NSF I-Corps alums have literally a 3x win rate on the SBIR. I think it's like 14%. Normally, it's close to 50% for national program alums. That's because you can really, in the application, say, I've spoken to 115, whatever it could be, stakeholders, customers. Here's what I learned. Here's what I validated. Here's what I know from talking to them. Here's the big problem that I discovered. And here's how my technology or solution can solve it. And here's what I know the willingness to pay is. Now I need some money to go and build it and bring it to market. And it's a very powerful thing to be able to say to any investor. I will also mention every quarter, we run a collaborative I-Corps course with the Berkeley Life Sciences Entrepreneurship Center. As you might guess, that has a curriculum tailored specific to life sciences startups. It's taught by Darren Cook. Darren's the executive director of LSEC. He's a biotrack chair at Berkeley Skydeck. He's a longtime I-Corps instructor, very passionate about this, great instructor. So for anyone in that space, the next I-Corps at LSEC course is coming up in early October. It is slightly tentative because Darren, I know, is very busy this fall, but I think he loves it. So it looks very likely that we're going to be able to keep on that quarterly schedule. We'll do it. So open invitation to any and all in here for that course. But we've got another one coming up in August. Applications are open for that now. So just as good. Most of our instructors, and I'd say the majority of the teams, are sort of life science space just about every month. So I guess the very last slide is just this. So I don't know if anyone here knows Nikki. Charles must. She did the course 2 months ago or 2 years ago. So I found these old tweets that I remember. I was like, wait a minute, that might be a nice thread. Nikki's fantastic. She was in the very first I-Corps LSEC course we ran, taught by Darren. It was sort of an experiment there. Let's try this. And she just thrived. She did the National NSF I-Corps program. And I heard that she is on the very last cusp of receiving the NSF SBIR. They're doing some last due diligence, but seems I think once you reach that point, almost assuredly that she will get it. So I don't know, very, very cool to see the success stories. And I think there's a lot of resources and support out there for especially teams coming out of the university who are exploring entrepreneurship. And tapping into those, whether it be NSF, ICOR, or otherwise, I think these are incredible resources that really weren't around 10, 15 years ago. So that said, I'll stop sharing there and hand it back off, I think, to Charles.
Hey, Dave, that was a great talk. I really appreciated all the sort of anecdotal or the examples that you used, and the whole concept of the technology versus the customers is so thought-provoking and a little bit counterintuitive, but I see it for sure. And this year, we're encouraging all the Catalyst Award teams to take the regional, the 1 week, the Monday, Wednesday, Monday, and Dave's facilitated that for, I think 4 or 5 or 6 have already done it, and 2 or 3 are lined up to do it this summer, or this fall. And we're really appreciative of the teams that have done it and the ones that are going to do it. So thanks a lot. Any questions for Dave from anybody on the call before we move to the second half? Any questions at all for Dave? You can put your hand up or you can just shout it out. And it's completely, oh wait, there we got one. Durai, go ahead.
Yeah. Hi, Dave. Thank you very much for this informative kind of presentation. I'm currently at the Buck Institute in the Bay Area. So in your presentation, when you started, you said this is for specific institutes like Berkeley, UCSF, and Stanford. Am I allowed to take part in these programs, and how can I do that?
Yeah, absolutely. And I should have extrapolated there. So we have so many different universities who come to our program, or founders from different universities. So absolutely, you'd be welcome. Would be thrilled to get an application from you. Our website is bayicor.com. I'll put it in the chat so you've got it. Our application's there. August applications are open now. And we also have that October course, which is the life sciences specific. Either one would be great, but yeah, check out our website. All the application is there, and also put my email in the chat. So if you have any specific questions, we'd be super happy to connect offline after this session.
And Dave, don't you have 2 coming up in October as well? Don't you take September off, but then you pick it up again in October?
Yeah, we kind of have one in like later August. I think it's 21st, 23rd, and 28th. And then it's like the first week of October 2nd, 4th, and 9th. And that'll be, actually two cohorts. One, very likely the life sciences specific one, taught by Darren. But yeah, it's really whatever timing I think is best for the team is what I would always recommend. So if August is best for you and you have the time to invest in it, do it in August. If October works best, October's great. And we do it every month. So we'll have another one in November and December. But in many ways, the sooner you can do it, the better.
Thank you, Dave.
Yeah, thanks for that question, Durai.
Yeah, great question.
Any last questions for Dave before we move on? Okay, great. So Dave, thanks again. And we're going to turn it over now to Ty Hagler. And he's going to be giving us a really interesting, he's going to be talking about design thinking. And you think, design, how does design, impact a drug or a COVID test or a medical device or digital health solution or the like. So, and then Ty is also going to introduce himself. And without any further ado, thank you very much, Ty. I'm going to turn it over to you.
All right. Thank you, Charles. And Dave, as I was listening to your presentation, we have so much agreement between the ICOR content and wanting to make a value judgment of doing market pull instead of technology push. that so often in healthcare, there is kind of this overwhelming emphasis on the technology, but rather it should be something where you're emphasizing solving real problems for customers. And I use that same CD insight in some of my presentations, just to illustrate that point that like building something that nobody else wants, just because you fall in love with the technology is a very, very common mistake. And so that's not anything proprietary to you. So my name is Ty Hagler. I'm the principal at Trig, which is an industrial design consulting firm. My undergraduate degree is from Georgia Tech in industrial design. And then my master's, I got an MBA at NC State, which was a combination of innovation and marketing. That was really where I did my first medical device program. As I left Georgia Tech, I was part of Home Depot's in-house innovation department. And so got to see just about anything that was on the shelves there and work on, basically, any different types of products there. And then translated a lot of what we learned about innovation in retail to medical devices, because there is a lot of crossover between power tools and how humans interact with and implement and surgical devices. There's so much opportunity from other industries to bring in novel insights and innovation. So I started Trig in 2008, and so I've been doing any number of different medical devices, digital health technologies. Haven't really worked on pharmaceuticals or therapeutics. So as Charles and I were talking beforehand, it's kind of a question mark in my mind of, can design thinking contribute to that space? And that's something we've had a fun debate over. So I am set up to talk about design thinking. I do want to react because Woody was very kind to give me a question leading into this. I'm going to take me off topic a little bit from design thinking. But Woody was reading my LinkedIn profile and saw that I had a number of patents, and asked for my opinion about the value of patents. And just want to point out that a patent is a way to get a monopoly. So you pay a tax to the government for a monopoly on a given idea. So that's not actually a market signal of customer success. That's just you paid a tax. You can pay a tax to the government to have a monopoly on balloons on your head. That doesn't actually mean anything about whether or not customers would adopt this IP that you've generated. You just created a monopoly on something that may or may not have value. Some of the patents that I've worked on have been incredibly valuable. Others have been just superfluous design patents that you just kind of do to run up the score on, kind of the number of patents your startup has, and doesn't necessarily add any real value to what you're doing. So oftentimes it's a red sign when I'm talking, or a red flag when clients come to us and they are overemphasizing the patent that they have, and they haven't really spent time really thinking through the market and what the real demand is there. So I just, I have caution when talking about patents, that it's a tool. It's not necessarily a sure sign of success. So I have a much longer soapbox on that, but I'm here to talk about design thinking. So I'll stay on message. Okay, so I'm going to go ahead and share my screen. Hopefully I share the right one. One other thing is that we run a weekly podcast where we talk to medical innovators. And actually one of the UCSF Catalyst graduates, Dr. Tom Sorrentino, was a guest of ours. If you do feel like you have a compelling story about some of your journey as a medical innovator, would encourage you to reach out to be a podcast guest, and also like and subscribe to support the podcast. Okay. All right. So we're here to talk a little bit about design thinking as it relates to healthcare product development. So a lot of this, what I'm going to cover is more theoretical, but I wanted to start off with something that's a little bit more practical. When you think about the bell curve of the human population. So if you think about it, most of the typical focus when you engage in a design project, you start to think about, well, let's think about the median point of the bell curve, maybe that middle 95% of the data, because that's going to capture the vast majority of our market. But instead, what I'd like to do from a human-centered design standpoint is to focus on the tails, because if you focus on the first percentile or the 99th percentile of the market, you're going to be able to account for those edge cases where your design is going to break, your products is going to break. And so if you can account for those and attack those first, then the middle often winds up taking care of itself. So an example of this, which is a fun prototyping story here, we're working with a startup that is doing a, robotic catheterized transseptal mitral valve replacement device. And the technology behind this is really cool. The ergonomic story and usability story is really cool. And so early concepts for this were storyboards and illustrations to describe how this use case might unveil. Then later on, as we got into the actual fitting of the components into this, we had to ask the question of, is this going to be usable? And so a quick mock-up here that you see on the right is a picture of really some foam mock-ups that are based on 3D CAD models. That is like some really cheap styrofoam that pulled out of Home Depot. And then that's actually a kebab skewer stuck in there to represent the catheter line. And then that's my daughter, who's 9, her hand gripping that to describe what a first percentile hand size might be able to accommodate with all of the tech we had to fit in there. So as far as accommodating for the largest and smallest hand sizes, sometimes you can address that through relatively low cost experiments that only just take a little bit of fabrication time in order to get to a net result. Okay, so that's just kind of a quick teaser for some examples, but ultimately, as Charles let in on this, kind of starting to scratch your head and ask this question of what is design thinking when you get down to it? And so these are each examples of some different projects we've been a part of where we've utilized design thinking to arrive at a novel result. But ultimately, I want to take you back on more of a history lesson as far as where did design thinking originate, which ultimately it's empirical thinking, where knowledge is gained through experience of the world, not necessarily through reason. So you think about Leonardo da Vinci, where he was looking at cause and effect and experimenting and doing lots of low-cost experiments with any number of different topics. And so part of that was just looking and seeing what worked, trying things in his studio, and then trying to figure out what may or may not generate a novel result. He was a scientist, he was a artist, he was an engineer, he was quite the polymath. So ultimately, if you think about a definition for design thinking, it's a mindset and a framework for solving problems. It's not fail-safe, it's not predictable, nor is it linear. And ultimately, we're making a value judgment when we engage in design thinking that we're prioritizing the customer's needs above everything else. Yes, we'll eventually need to deal with profitability. Yes, we'll need to eventually deal with feasibility of will it work or not. But ultimately, we're trying to make sure that the stakeholders' needs, are we solving, as Dave was pointing out earlier, are we solving a big burning problem first, and then we'll figure out how to get there. Also, as you kind of saw from some of the earlier examples, it's iterative, it's hands-on, and ultimately it's a pathway to generating innovative solutions pretty consistently. So the first industrial designer was Raymond Loewy, and so this was an example of some of his famous work where he was using concept illustrations in safe-fail experiments to test out whether a new streamlined locomotive would be appealing or not before they actually committed to actually building the full streamlined locomotive. And so he had teams of industrial designers working under him, generating these concepts, and ultimately arriving at, say, the Lucky Strike logo, Coca-Cola products, the locomotive industry, the Studebaker Avanti. There's any number of different products he worked on in kind of the early days of industrial design.
Hey, Ty, thanks. Can you describe those two sets of words, the fail-safe and the safe-fail? Because it sort of boggles me a bit.
Yeah, I know we talked about this earlier. So with fail-safe, you're trying to eliminate failure, right? Because you're setting yourself up to where if there is a failure, it's catastrophic. And so you want to eliminate any chance of failure. With safe fail, you're saying, I know I'm going to fail a lot. And so it's going to be an acceptable failure until I arrive at a successful win. And so it's an inversion of a curve. In most of, and you think about if you're actually approving a drug, say, for example, to go out into market for standard use, you want to make sure it's fail-safe. But the process of trying a lot of different compounds and molecules, you want to do that safe-fail in low downside risk experiments to test and see before you then start testing in actual animal model and human studies. So you're running lots of safe-fail experiments before you have to then operate from an efficiency standpoint in a fail-safe environment.
I've got it. Thanks.
Okay. Okay, so then fast forward a little bit more further. So Chuck Harrison was a prolific designer for Sears Roebuck. So he generated some 600 different products over the course of his time there. One of which came from an insight that he heard these noisy trash cans out in the street in Chicago, whereas the trash trucks would come by, these metal cans would be banging, making lots of racket early in the morning. So he then came up with the plastic trash can, out of identifying a pain point and then designing new products to address those pain points. And he had some wildly successful products during his tenure at Sears. So you think about this progression of physical products has been talking about. And so one of the unsung heroes that really made design thinking into what it is today is Jane Fulton Surrey. And she joined IDEO as an anthropologist to really study these funny humans that we're designing for, to try to look for where are some of those, how are people utilizing things? How are they understanding it? What are some of the, I guess, the duct tape solutions they arrive at, where they try to use a hammer as a doorstop, or they're using the handle set and deadbolt as a place to store mail. These are mock-ups for solutions, but really these are observable phenomena where you could identify novel solutions as a result of human behavior. And some of that just comes from studying like an anthropologist. Some of our most productive work has been in partnership with anthropologists because they have that approach to really trying to understand humans. So then you think about the jump that happened with Apple and Johnny Ive and Steve Jobs, where you go from the domain of physical goods to software, where we're extending what the experience of interacting with a product is, as you then think about how do you move the physical buttons from the BlackBerry to your iPhone where it's a touchscreen and you can iterate on that experience. And so extrapolating further, we talk about the story of Doug Dietz, who is the engineer behind the MRI scanners for GE. And he gives this TED talk about his experience of having done all of this work and painstakingly designing the MRI scanner. And as he was walking through the hospital, there was a child who was just in sheer terror because they're about to be subjected to experiencing the device that he designed. And so that then, set him out on a quest to then figure out why was this happening and what can we do? And so as you can see from the image here, he went through and then didn't change the product at all, rather changed the experience and made it to where he engaged the imagination of children so that rather than have this be a terrifying, sterile experience, rather just put decals down and then told a story about how they were going on, say, a pirate adventure. And during a key moment where they needed to sit still, they sat still during the MRI machine because otherwise the pirates might find you and they're on a fun adventure. And so engaging the imagination after having gone through this process, children came back and they were gleeful and said, when can we come back and do this again? So they didn't do anything transformative to the technology, rather they changed what the experience might be. And so ultimately, that's where I think design thinking can really make a big impact for healthcare. So the story I'm trying to tell with this history lesson is that what we're calling design thinking really is a fractal evolution of smart, effective design, where we're taking what works in one domain and applying it to the next. And then ultimately, I think the future for what we're calling design thinking or empirical thinking is when we get into complex system design, where you've got interactions between really interesting complex systems. Then how do you make forward progress in that environment? And I think design thinking gives us a lot of tools in order to make sense of those kinds of changes. So I've just been building up design thinking as this, kind of magical catch-all is going to solve all of the world problems. I really also want to say, okay, well, let's define where it does not work. So to do that, I want to introduce a framework, which is a Welsh word. So you see the word up there at the top left. And I like this as a pronunciation test of, can you pronounce this word? And, usually if we have mics off, people say, well, what do you think this is? So it's pronounced Cnaven, which obviously that'd be it, right? So it's a Welsh word that means the place. And so it's describing 5 different domains, which involves, the clear domain, which the relationship between cause and effect are very obvious, and you can easily point that out. So think about your commute into work. You kind of have a very clear idea of what efficiency looks like as you're going into work. With complicated, you can write an algorithm to describe the relationship between cause and effect. Think about trying to travel across the United States. There's any number of different permutations of that, all of which can be anticipated and deliver you from one side of the country to the next using fail-safe methods. In the complex domain, the relationship between cause and effect can only be observed in hindsight. So in this case, we're going off and we're discovering new territory. There's been a new island discovered in the Pacific. Nobody's ever been there before. It's covered in thick woods. So you're about to go over there and journey through this undiscovered territory. And you need to use safe fail methods in order to navigate this because no one's ever been there before and you don't have the ability to scan it in the first place. In the chaotic domain, this is where you're in an emergency room, you're in the early days of COVID, you don't really know what's going on, but the worst thing you can do is sit still. Go left, go right, but if you sit still, the dragon eats you. And so those are the 4 different domains, and the strategies behind each of those 4 domains are different, which is the key thing about the sense-making model. And so if you use the wrong strategy in the wrong domain, then you're in the 5th domain, which is confusion, where you think you're in the clear domain, you're just driving straight down the road on your way to work, and a tornado comes across because you didn't change and takes your car away because you didn't change your course because you're worried about efficiency, when really you're in a chaotic domain. So if you think about this, this is where I'd say that design thinking is most applicable in the complex domain, where you're introducing humans to a novel new change that's asking their behavior to change. And there's no data up until this point to support it. So you're having to generate data by running experiments and then make changes based upon how you're responding to that data. And so this is really where design thinking shines. And if you try to use design thinking on your daily commute to work, then I'm sorry, just a poor application of it. So, with that in mind, I also want to offer a disclaimer for anyone trying to practice this. So if you're experiencing a life-threatening medical emergency, do not attempt design thinking. Put down the sticky notes and call 911. Do not use design thinking to plan your daily commute to work. Design thinking is not a substitute for actual thinking. Design thinking does not replace having a trained designer on your team who has a track record of shipping products. Do not attempt design thinking without supervision from a member of the GSD Club. The GSD Club is exclusive to those who get shit done. Side effects of design thinking may include tinkering, obnoxious curiosity, enjoying your work, productive play, and obsessive compulsive attention to problems that are otherwise ignored. So now that we've got that out of the way, we can kind of dig a little bit more deeper into design thinking. So, okay, ultimately, you're going to see a lot of different models for design thinking. And the fundamental insight behind design thinking is that our brain operates in 2 different modalities: divergence and convergence. Most of us favor one versus the other. If you're seen as more creative, more open, then you tend to live in the divergent world where you're perpetually opening up new ideas and then deciding which path to go down is more challenging for you. I think in medicine, we tend to be in more of a convergence mode where you want to, if within a 10-minute time with your patient, you need to be able to quickly make a diagnosis and move on. So it's about making the right choice, applying judgment, filtering, categorizing, and prioritizing. The thing is those are 2 very different aspects of your brain. And so as a team, you want to make a decision on which one of these are you working on. You need to be able to flip back and forth between both of them. But the minute you start applying judgment in a divergent activity, that's when you've then shifted it from we're perpetually saying yes and exploring out, and you're now shifting it back down to let's converge on the right answer because it's time to move forward and make forward action. So it's having patience for which one of these we're in. And then as you think about the different design thinking models that are out there, you either have 2 diamonds, 3 diamonds, or whatever, it's a 5-step process or whatever, but ultimately it's on this fundamental insight of how does human creativity work? Okay, so let's see. So then I want to just kind of dispel this notion of the perfect design process. And I think this Catalyst program is a really good example of, basically that if you were to try to create a design thinking process for pharmaceuticals, for therapeutics, for medical devices, for digital health, that ultimately I think that it's the sign of someone who understands what design thinking is to create a process for that specific application. And I'll go even a step further that for the company that you find yourself in, Stanford Biodesign works really well at Stanford. I think if you find yourself in a new environment, you should be tweaking that model to make it so that it fits the culture and context in which your organization is operating, because that is ultimately an expression of the culture of innovation and the broader culture that you're in. So just from an example, so when we teach design thinking, we offer a very, I guess, constrained model for what design thinking is. But then as you grow in your skill set and you try it consistently over and over again, that you'll find that as you reach kind of more of a grandmaster status where you're teaching design thinking to others, then you're figuring out how to apply it in new and novel ways. So we did a research study where we looked at the journey of becoming a woodworker. So you became a master at woodworking. And so one of the rites of passage of being a woodworker is that you would build your own woodworking table. I think similarly within design thinking, you should be adapting your own design thinking model to fit your context off of some of these fundamental principles, but ultimately how you go about approaching it is something that's more flexible and based upon what the specific needs of your context is. So with that in mind, the med design program that we've been building and working from has this fundamental thesis that good design is good for healthcare. We built it with in partnership with UNC Health's Fast Track program. And so the idea was to provide training for healthcare providers in entrepreneurship. It also starts with a hypothesis that the customer research has already been completed because we're talking to the physicians who are getting started. And so ultimately it's by talking to the physicians and clinicians that ultimately that they're the most empathetic to patients and would be able to then extrapolate from there, for all of the affected stakeholders. So in terms of how we go about approaching this, we start off by doing problem scoping. And if we don't have a good understanding of the customer, then we need to kick you back to the I-Corps program because you do not pass go, do not collect $200, kind of go back and make sure you understand the customer. Because otherwise you wouldn't be able to complete the rest of this. So going through and mapping the journey of each of the stakeholders, going through and building out your empathy statements, where are the greatest pain points in the journey across an entire process map with multiple stakeholders. The hardest thing to write is a need statement that is solution-free statement of need, and then you're prioritizing those using the level of alignment. Ultimately, we're asking this question of what is desirable. Once we've clearly defined what the unmet need is, only then can you then engage in creativity, where you've got a core foundation, and then you can then build out on a lot of different techniques and methodologies to generate a wealth of ideas, synthesize and converge down. Most concepts can be written up as a concept story in terms of storyboards, and then from there you can de-risk them and do prototypes and iteration. So I think I've got a much longer talk that I could dig into around human factors, but I'm going to pause there and maybe then we can open up for more broad questions. I want to just say also I really appreciate kind of getting to share this talk with Dave because I think that our two topics dovetail nicely with each other. So anyway, from there, kind of curious for any reactions or questions.
Well, Ty, you know what? Thanks so much. I really, I enjoyed in the very, very beginning when you had those famous designers and, what was driving them and what they came up with. And obviously we're familiar with a lot of that stuff. So it was really pretty cool. And, the concept of architecture versus engineering, it was reminded when I saw that locomotive because those old Art Deco locomotives are just so amazingly beautiful. So questions for Ty from anybody on the call?
I have a question. My question would be, so essentially, it seems like from the presentation, design thinking is or multidisciplinary, but I guess my question to you would be, because it seems somewhat broad, so if you had to applying that convergent thinking mindset, so ultimately what would be some of the central, and of course you've covered some of that, but I'm just trying to get a grasp of what the core of design thinking is, particularly within a healthcare setting. You mentioned at the beginning thinking about those outliers, those two ends of the curve. So is it like within, let's say within a specific healthcare context, would that be thinking about accommodating, let's say, patients who use your facility, thinking about, let's say, patients who rely on wheelchair mobility? Or I guess ultimately I'll stop there by saying what is design thinking, especially with respect to how it can be applied in a healthcare context. And if you can share like an example, I would appreciate it. Thank you.
No, that's good. I appreciate that. And I'll share my screen again just to show a couple of examples. Okay. So, we worked with a wide variety of different teams. So one of which was looking at is the hematology group at UNC. So it was a cross-disciplinary group of pediatric providers, adult hematologists, specifically looking at care transitions for adolescent young adults who have sickle cell. And then the mortality rate, if they don't get adequate care in the transition between pediatric care and adult care, winds up having a very high mortality rate. And so as we started working with this team, we actually had 2 different rounds of the empathy module with them, because getting this many disparate stakeholders to agree on what truly the problem was and the causes for the increased mortality rate wound up having lots of back and forth. And so, ultimately what we wound up doing is then arriving at a validated set of need statements. And then from there, which was fascinating, because what the providers thought the problem was, when they went out and actually talked to the patient, their patients who they work with every day, and asked them about these problems, they had a very different take on it. And so we were working directly with some of the stakeholders, but not all of the stakeholders, and making sure each of the stakeholders talk to each other. Wound up being a very rewarding experience and built community. And so as we then worked with this team to then generate solutions, what was fascinating was some of the solutions we came up with were digital health solutions. Some of them were physical artifacts, but then others were just improvements to the clinic and how the clinic operated, and welcomed some of these rising teenagers into the adult care center, and made it something that was more of a kind of like the GE MRI scanner, of making it so that it wasn't scary, but it was welcoming and familiar, so that you don't have, as these adults are having to care for their own healthcare, that you make it so that they, were like with, when I was a 20-something, I didn't go to the dentist very often. The downside risk to me wasn't I had a few cavities, but for some of these young adults, if they lose track of their healthcare, then it can be, catastrophic, and have to go trips to the emergency room and all of the challenges there. Another one was around remote care for patients with hypertension, and looking at the overall challenge here, which is a clinical informatics group. It was, really looking at rural North Carolina and how to care for just diverse populations. And so what we wound up doing with this team was then coming up with lots of different possible concepts for them. But then ultimately arriving at, say, this kind of concept of, out of a box, you have your blood pressure monitor, but then you also have a tablet that has instructional videos, that has all the data included, and can then also have a telemedicine where, like, it would, no matter whether they even have internet locally, you'd still be able to set up and function. And so as a result of this work with the team, they're actually able to be awarded a $5 million grant, in part because they demonstrated that they had already been working together and had a clear idea of what a solution could be, rather than just kind of having a theory of it. So it shows just the collaboration across colleagues in a context that they wouldn't necessarily see. So it's facilitation using design thinking tools, but then also making forward progress down a solution where you think about this, there was no informatics model built up for this. We didn't go through and actually have to fabricate anything. These are just storyboards. And so it's low risk, low cost in order to be able to get to a result like this that can demonstrate progress and de-risk and show forward momentum. So anyway, Woody, hopefully that kind of shows you some quick examples there.
Yes, thank you. That's helpful. Thank you.
Ty, I have a quick question. For being a good design thinking what approach is good? Is it kind of a reductionist approach or a holistic approach?
So a holistic approach versus a
reductionist approach. So you just break things apart and try to find what is necessity, or you take into consideration of everything that is necessary in a situation, and then you do your design.
So I think from a design thinking approach, first you're trying to define clearly what the problem is. And so it's a prerequisite, you have to have understood each of the stakeholders. And so that's where the empathy comes in. And so part of this is making sure that you've got it as narrowly defined as would arrive at a complete product. Some of my favorite examples of this is the sticky note. So the original use case for the sticky note was actually very narrow. The inventor of the sticky note, all they were trying to do was to keep their bookmark from falling out of the book. That's it. And so they were then playing with glue, they were playing with lots of different options for this. And so it's thinking about what is the most narrow acceptable problem can I focus on that has the biggest pain point for stakeholders. And then from there, the possibilities of what you can do with the now ubiquitous sticky note can then broaden out from there. So you want to be narrowly defined on what the problem is you're solving. And then from there, open yourself up to as broad array of solutions as you possibly can. So one of the things we teach is that quantity is quality. That you think about from a statistics standpoint, the first idea that you come up with is likely not going to be your best idea if during this exploration you're coming up with 300 ideas. So you want a wealth of ideas through design thinking so that you're choosing between lots of great options and have those options to validate with the end customers who you asked, is there a problem? So then you're coming back to those same customers and saying, you told me this was a problem. Now here's 5 different options for solving that problem. Which one of these might work for you? And sometimes, and oftentimes with the design process, we then arrive at some combination of multiple different solutions because the actual end result is never obvious. And I'm always surprised every time I run through a design thinking process, because every time you ask the customer, what would they want? It's the hardest test you'll ever take. As Dave alluded to there with the CB Insights research there.
Yeah. Do you think with the advancement in the AI and everything, design thinking can be automated?
Can design thinking be automated? Well, my experience so far of some of the AI tools that are out there is that it can be very helpful for solving the blank canvas problem. Mm-hmm. Meaning, if you're staring at a blank canvas and you generally want to start thinking of something, then you can input like, oh, hey, I've got this problem facing, give me 10 ideas for how I might solve this problem. And it'll give you 10 ideas and get you started. And those are the obvious ones. Those are the ones that the mediocre MBA student will come up with, or kind of that are run-of-the-mill concepts. And so your job at that point is to then come up with the next best adjacent idea to what this will come up with. So it's a tool that accelerates that process and helps you be more creative. But I think it shifts the work from generation of ideas to curation of ideas. And so it's a very powerful tool. I've gone into let's say you want to fill out, say, a marketing plan or say a business model canvas. And so tell me about what the business model canvas is for value-based care in a very specific context. It will spit out how to populate the business model canvas to get you started. And then from there, it's your job to be an intelligent curator of that information and then to make forward progress. So we can't advocate to the AI yet.
Yeah. My last question, connecting Dave's presentation to yours regarding customer discovery, how much customer discovery analysis will be helpful in terms of design thinking?
I would say that design thinking without customer discovery is malpractice.
I didn't get that. Sorry.
Design thinking without customer discovery is malpractice.
Okay.
Okay. If you're going through and trying to generate a design for somebody, you're in design is a willing acceptance of constraints. And so you're going out and trying to understand and design for somebody. And if you're only designing to make yourself happy, that's art. And even then, art is still expressive and meant for other people. So it's something you're doing for yourself. And if you're doing design, you're doing it for other people. And you have to check to make sure you've actually served the needs of other people. Otherwise, you're just kind of doing something for yourself.
Nice. Thank you.
Ty has really good disclaimers. Like a second amazing disclaimer.
I had a chip on my shoulder when I wrote that.
Okay, thanks again, both Dave and Ty. We all really appreciate it. Both very, very thought-provoking. And thanks so much for making the time. Hope your kid got to sleep fine without you in North Carolina.
Nobody
And
showed up here.
thanks all for joining. And the next workshop is 2 weeks from today. And we look forward to seeing you then and there and here. Okay. Bye-bye
Thank
all.
you.
Thanks,
Thanks all.
everyone.